My name is Hoor. I'm a fourth-year medical student at Kuwait University, and I'll be talking about the treatment of postburn leukoderma by VT treatment. First of all, let's identify a couple of terms. Postburn leukoderma is the whitening of the skin that is caused by a second-degree burn that reached the melanocyte and destroyed it, while VT treatment is a treatment methodology in leukoderma cases that uses pulse oxidant followed by an antioxidant shock to treat vitiligo and other leukoderma cases. This treatment was patented by Kuwait University Faculty of Medicine and was recently commercialized. Within the cases that use VT treatment during the clinical trials evaluation, we have two cases that have postburn leukoderma. One of them with a recent postburn leukoderma and the other with a postburn leukoderma that lasted for several years. Both cases have clear whitening of the skin after the wound was healed. We have applied the VT treatment methodology and therapy for these two cases for 3 months, and then we followed them up after the recovery for also 3 months to make sure that they reached complete repigmentation. And after the follow-up, when we stopped the treatment, there was fortunately no recurrence of the leukoderma. So in conclusion, we have two cases of postburn leukoderma that suffer from whitening of the skin. And we have applied the VT treatment methodology, and it showed that the VT treatment methodology was successful in treating them with full repigmentation. That's it. Thank you very much.
Thank you all for the presentation. Do we have any questions from the audience? Thank you. Now we move to the